Good evening, everyone. I'm Chad Mira.
And I'm Lauren Culver. Thanks for watching KX News. In our top story tonight, healthcare facilities and availability. In rural North Dakota, they can seem far and few depending on where you live.
With more than 750,000 people living in our states, it's estimated that about half of North Dakotans live in rural areas. That's according to the Economic Research Service. But there are only 53 rural health clinics in the state.
That means there'd be more than 7,000 patients seeking basic health care from any individual clinic. Becky Farr shows us what some areas are doing to keep their communities healthy.
Bottineau, North Dakota has a population of about 2,255 people. For all 2,000 plus people, the only local option for basic health care for years was St. Andrews Health Center. St. Andrews CEO Alfred Sam said the clinic sees an average of more than 9,000 patients a year, covering populations within about a 30-mile radius of Bottineau. The hospital covers most major health care needs, but immediate walk-in care is where a larger need seems to be. Just last month, the first walk-in clinic in the area opened its doors.
Frequently, people would mention that it was tough to get into the local clinic, and then they were having to drive elsewhere, as far away as Minot, to come in for walk-in type care, and it was basically a burden for them.
St. Andrews remains as the only place to see a medical doctor in Bottineau, while Pyramid Health will serve the needs for non-emergent care.
It's getting harder and harder to find health care that you can get into in a timely manner.
Cuevelis says feedback has been positive, with people happy to get in quickly. So far, about 1/3 of his patients are coming in from West Hope. Trinity Health closed its West Hope clinic in 2017, but in June, Pyramid Health will open an office there too.
I've noticed where the older people, it is so hard for them to drive to Minot or to Bottineau.
Diane Lessman, a registered nurse from West Hope, just joined Pyramid Health. She sees the need for more accessible care in her hometown.
They have a right to have it right there. A community like West Hope is very close. It's like a family, and they want to know each other, so then we help one another out.
Soon, the town of less than 500 people will have access to basic care 3 days a week. With these two new walk-in clinics in the area, the need for serious care remains. You must travel 60 miles from West Hope or 80 miles from Bottineau to reach Minot, the closest hospital for life-threatening care. And that's a concern for residents beyond north central North Dakota. Residents 100 miles to the southeast in Harvey face the same healthcare concerns, but they too are working to meet the needs of the community.
I'll get your vitals.
Like St. Andrews, St. Aloysius Medical Center in Harvey is equipped with a critical access hospital, a long-term care unit, and several other services like radiology or lab work. St. Aloysius was founded 85 years ago, but just opened its walk-in clinic last August.
It was a great hospital, and people went into the hospital. What we've seen now is many more things are outpatient, because you can really get better quicker at home.
Before that, there were only 2 other basic care options in the area.
There's that saying, if you build it, they'll come, and we are seeing people come.
The clinic sees almost 600 patients a month, and Zwicker says it's likely to top 1,000 patients a month by its 1-year anniversary. He says responding to the needs of the community, which includes Harvey's estimated population of 1,700 plus surrounding towns, is what will keep St. Aloysius and the community alive for many years to come.
With the patients that we are seeing, we have to expand, we have to grow, we have to accommodate that. Because the last thing we want to do is say, we're here for you, yet we can't take care of you.
Here is a map of the 53 rural health clinics in the state, and it actually doesn't include St. Aloysius or the 2 Pyramid Health clinics in West Hope and Bottineau. You can see that there are several areas without clinics where residents have no choice but to travel for basic health care, something places like Bottineau and Harvey are working to change. Becky Farr, KX News.
Hospital administrators say part of the challenge of providing basic health care isn't always proximity. Timeliness is huge, too. That's why the clinics mentioned in this story are working to establish more providers so that patients can be seen as soon as possible.
New today, the president